Hello everyone, welcome back to another session in dentistry and more. Today we have a topic that is primitive medicine, which is from community medicine or public health dentistry. This includes the ancient medicine, how the medicine or the medical system treats diseases in the ancient times, and even a little bit about the dental aspect. So it includes basically the Indian, Chinese, Egyptian, Mesopotamian, Greek, Roman, and medicine in Middle Age time. So in ancient time, it was believed that disease was attributed or disease was caused by the influence of demons or planets or by the wrath of gods, and it was treated by very unscientific and unethical methods of dancing, magic effects, charms, and various religious measures. Each religion has their own rituals to treat the diseases. So when this demon is able to enter the body, that means if the demon creates disease in a body, by any of the above mentioned method, the efforts were made to make the body uninhabitable to the demon. That was a solution for the problem. But each medicine or each religion used their own methods, just like beating, torturing, and starving the patient. Archaeologists recovered skulls of the ancient humans, and they found out very surprisingly the trephination in the skull added trephination, creating a hole in the skull so that it leaves the body. That was a thought in ancient times. And while coming to this dental part, so this dental procedures were done by various equipments, just like you see the picture here. Now we have the Indian medicine. Our country has its root of Ayurveda and Siddha. The Ayurveda, which originated in Vedic times, that is around 5000 BC, and Ayurveda means nothing but knowledge of life, and it is based on Tridosha theory. So Tridosha means the Vada, Pitta, or Kapha. Vada is a force that holds together Akasha and Vayu. Pitta is a force that holds together Agni and Jala, means water. Kapha is a force that holds together Prithvi and Jala. So all these are the 5 elements like Akasha, Vayu, Agni, Jala, Prithvi. Now, while coming to the Tridosha, Vata, make sure that your body movements take place without any obstruction. This includes absorption, nervous system conduction, and all types of excretion, breathing, and musculoskeletal function. If anything goes wrong in this part, it is due to the imbalance of Vata. And Pitta it has an equally important role in keeping together the two very opposite qualities of fire and water, just like an acid, which are fluids in their existential state but burn. So Pitta governs this principle in the body. It brings about transformation, acts as a heat energy, digests food at gross and cellular levels. So it imparts warmth, vision, and color to the body. Whereas the Kapha is a cohesive and lubricating force that holds together the opposite elements of Jala and Prithvi. So Kapha force makes the body stable, the structure is well held with muscle, tendons, ligaments, and fats, and it also forms the protective covering and fluid shock absorbents for joints and the brain, that is cerebrospinal fluid and spinal cord. And we had very eminent people in those times like Atreya, Charaka, Sushruta, and Vakpata, and the very famous books like Charaka Samhita and Sushruta Samhita, which has got mention about various diseases and treatment procedures. So Ayurveda basically divided into 2 fields, that is Salakya and Salya, and the Sushruta, one of the renowned surgeon of those times, he used 2 sets of instruments, Yantra and Sastra. And early Indians, they are excelled in cataract operation and plastic surgery. and this Sushruta is known as a father of plastic surgery. And 800 BC to 600 AD was known as a golden age of Indian medicine. Moving on to the dental part, dentistry was held to be of a divine origin in India, and this dislocation of jaw was thought to be due to the rush of air. And Indians would never use a toothbrush with animal hair bristles because they consider many animals as gods, and instead they would use twigs, leaves and other such things. And Unani and homeopathy were the sum of the system which existed in India in those times. Moving on to Chinese medicine. Chinese medicine was the world's first organized body of medical knowledge which dates back to 2700 BC. And this traditional Chinese medicine was based on two principles, that is Yang and Yin. So this Yang and Yin in the traditional Chinese medicine, this concept lays the foundation for understanding health as well as diagnosis and treating illness. So according to it, all phenomena is composed of two opposite but mutually interconnected forces known as Yin and Yang. So this Yang, which is associated with consciousness, mind, brain, spinal cord, nerves and nervous system, whereas the Yin, which is associated with emotions, heart, blood vessels, capillaries and other circulatory system. So there will be imbalance between these two and creates disease. And it was reported that Chinese would use arsenic to treat decayed teeth. Later they developed the silver amalgam which was used for decades in dentistry. And they developed this silver amalgam more than thousands of years ago. And first cleft lip surgery was performed in China during the 250 BC time. Acupuncture and barefoot doctors, they were the very unique the treatment strategy or the type of community doctors in China. Acupuncture is a special type of treatment where they have the pressure points like 160 points is connected with various parts, and they use these points to reduce the pain or treat the disease. Altogether, the body has 360 points and 116 among them is connected to teeth and oral structures. And treatment supplement to acupuncture was moxibustion. It's a type of traditional Chinese medicine. It involves burning moxa. It's a corn or stick made of ground mugwort leaves, and this is burned on or near the body's acupuncture points. And the practitioners believe that the resulting heat, which helps stimulate these points and improves the flow of energy in that part. And Chinese were pioneers of immunization because these barefoot doctors, they walked from door to door or from house to house to treat the people with disease or give immunization or vaccination. So traditional explanation for caries was a tooth worm or chong gya, and the tongue examination was important diagnostic tool. And they also believe that changes in tongue could reflect diseases and indicate prognosis of disease. And herbal medicine was also an important mainstay. Most frequently prescribed drug was ginseng. It is a remedy for various ailments, and they developed toothbrush in 1490s. While moving to the Egyptian medicine, there are two distinct trends, that is a magico-religious trend and empirico, that is a rational trends with scientific evidence. So medicine intermingled with religion in Egypt. So they believe that the disease was due to absorption from the intestine of harmful substances, which gave rise to putrefaction of blood and formation of pus. And they recognized dentistry as an important surgical specialty, and Imhotep considered both doctors and divinity. So medical manuscripts involves Edwin Papyrus and Ebers Papyrus. So Edwin Papyrus cites numerous operations of fractures and dislocations of mandible, compound and comminuted fracture of maxilla, perforation of zygoma. Hesire was the earliest dentist, and extraction was the principal relief of dental problems, and principal causes of dental disease was a coarse diet, and relief of toothache was obtained by applying a paste of cumin, incense and onion. And Egyptians excelled in public health, and god of health was Horus. While moving to the Mesopotamian medicine, the basic concept was religion. So Mesopotamia was a cradle of magic and necromancy. So geomancy and hepatoscopic divination characteristic of their medical lore, and prescriptions were written on tablets in cuneiform writing, and Hammurabi formulated the Code of Hammurabi, and these physicians were rewarded if successful and punished for mistakes, and grinding of teeth was considered dangerous and pathognomonic. The belief that the toothworm caused dental caries was first documented in Babylonia. Whereas the Greek medicine, it is a classic period from 460 to 136 BC. Asclepius was early leader in medicine, and numerous centers called Asclepions were established. First, the patient relaxed in the holy prisons, took in beauty of surroundings and enriched his soul by attending theatrical performance. Then he would present to the priest, who would give him a sleeping cushion and direct him to a mat where he would sleep. The priest would then advise a hypnotized patient as a course of treatment. So Asclepius had two daughters, Panacea and Hygia. Hippocrates was considered as a father of medicine, and he was also an epidemiologist, and these Hippocratic writings have numerous references to formation of teeth, eruption and their maladies. Whereas Roman medicine, Romans borrowed their medicine largely from Greeks. State was supreme, not individual, that was their belief. So public health was born in Rome. So Galen was an outstanding person among Romans, and his contributions in the field of comparative anatomy and experimental physiology was well renowned. So Galen stated about health, since it in importance and time health precedes disease, preserving health has to be considered and then curing. So he pointed the health is important. So preserving health should be more given more weightage than the curing of the same disease. So about disease, Galen observed disease is due to three factors, that is predisposing, environmental and exciting factors. Still we follow the predisposing and environmental factors. It is part of epidemiological triad, and the risk factors. So Celsus and Encyclopedists mentioned that special instruments were used for extracting the roots of teeth. Toothache was treated by mouth rinses, steam application and poultices. And if tooth had to be extracted, linen was filled in the cavity and then tooth was extracted. And his book included treatment of jaw fractures, repositioning of malposed teeth, ligation of loose teeth to stabilize them. And in Middle Age, the period between 500 and 1500, that is the fall of Roman Empire, the Europe was ravaged by diseases. Practice of medicine reverted back to primitive medicine. It was called Dark Age of Medicine. Arabs translated this Greek or Roman medical literature into Arabic. Borrowing from Greek, they developed Unani system of medicine. They founded schools of medicine and hospitals in Baghdad, Damascus, Cairo and other Muslim capitals. Leaders were Rhazes and Avicenna. The Rhazes was first to observe pupillary reaction to light, to use mercurial purgatives, to publish the first non-book on children's disease. He compiled Kitab al-Mansuri, which is the first book which includes dental anatomy, and he correctly identified mode of action of mandible, and he also gave various remedies of toothache, like instilling tincture in ear to treat toothache, and Avicenna compiled canon of medicine, and the greatest contribution of Arabs was in the field of pharmacology. And the golden age of Arabic medicine was 800 to 1300. And also Christianity exerted a major influence. Spread of Christianity led to establishment of hospitals. Early medieval hospitals rarely specialized in treatment of the sick, and first hospital on record was built in York. And during Middle Ages, religious institutions known as monasteries headed by monks, saints and abbots. So they used keys, special type of keys for tooth extraction. Okay, so that was all about this ancient medicine. So this ancient medicine is mother of all sciences. Medical knowledge has been derived to a very great degree from the intuitive and observational propositions and cumulative experience gleaned from others. So medicine is built on the best of the past. So that was all about this topic. This is a little bit about the history, but it gives you an idea about how the current system evolved from the past. So I'll come up with a new topic in dentistry and more. Thank you.